embarked upon was we felt it necessary to hire someone at the senior level who could really develop a unit in programming as we move forward as it relates to diversity, equity, and inclusion. And I am pleased to announce that we did, after a national search, we hired someone who's been around this university for quite some time, who is experienced in this area. On 2 occasions, she served as the interim VP for diversity, equity, and inclusion here at the university. She's worked on the Thriving Workplace Initiative. She's been a part of the University of Maryland for 25 years and is just a fabulous individual. So I want you guys to also give a clap to our newest employee, Cynthia Edmonds, who is our new Senior Associate Athletic Director for Diversity, Equity, and Inclusion and Organizational Effectiveness. So Cynthia, welcome to you. We look forward to working with you as well. Cynthia will officially begin on the 21st. Tonight's program is one that I'm extremely excited about. I'm looking forward to learning from Dr. Green what he has to share with all of us this evening. This is just yet another step in trying to remedy our communities, our society, our country of some of the issues that continue to plague us. I'm grateful to have Dr. Green join us. And with that being said, I'm going to ask Risa to officially give Dr. Carlton Green the proper introduction he so deserves. So thank you all for being here. Risa, I'll turn it over to you.
All right. So as Damon mentioned, Dr. Carlton Green, I like to call a friend. He is also the Director of Diversity Training and Education here at the University of Maryland in the Office of Diversity and Inclusion. For more than 20 years, he has held various roles in higher education settings while building collaborative and empowering relationships with students, faculty, and staff. He has always sought to advocate for institutional policies and programs that promote access equity for underserved populations. So with that, I will turn it right over to Dr. Green. The floor is yours.
Thank you, Risa. Good afternoon or good evening, everybody. I'm going to share my screen here really quickly with you so that we can get this going. There you go. Oh, how do we get there? Did you, can you see that, Risa? Can you see that? So, okay, great. Just want to make sure. So again, good afternoon or good evening, everybody. I'm Dr. Carlton Green. I use he, him, and his pronouns. I'm the Director of Diversity Training, as Risa said, and I want to pause here and thank Damon for having me here tonight, and also to say happy birthday to my friend Risa. I hope that there is a big fat piece of cake on the other side of this hour. What I want to be able to do today with you all is talk a little bit about this topic of racial anxiety and racial trauma. I am a psychologist by training, and so this is some of the work that I have been doing prior to coming into this role. So this is something that has been a real passion of mine for a really long time. I want to pause here really quickly and say again, good evening. One of the things that I have learned as a Black person living in this country is that to bid somebody good morning or good afternoon or good evening the first time that you see them, it is to say to them that it is not my intent to harm you today, and hopefully you won't harm me either. So I say again to everybody here, good evening. What I want to be able to do as we move into the conversation is really highlight for you how I came across this or part of the way that this presentation came to be. I've been here for a number of years. Back in 2013, I started as a psychologist in the University Counseling Center. And in 2015, Freddie Gray was murdered in Baltimore. And when Freddie Gray was murdered, there were a number of students who were coming into the counseling center at that time talking about their experiences of watching the news or talking to their loved ones who were in Baltimore. And many of you know that we are nowhere from Baltimore, so we have a lot of students from that area. As the students were coming in, they were talking to me about how it is that they were really feeling distressed and upset, and some of them were having difficulty going to class. People were really having difficulty focusing. They were really concerned about their loved ones. And so one of the things that I began to do was to print out a paper that I had recently written with some colleagues. The name of that paper was #RacialTraumaIsReal. As you see it there on the screen, if you were to Google that, you would come to a paper on the Boston College website, which is where I did my doctoral training. Some colleagues and I had written this paper, and it came out almost right at the same time that Freddie Gray was murdered. We, a group of psychologists who had all graduated and had moved to different parts of the country, were checking in with each other around the numerous videos that were showing up on social media and in the news media, showing Black people being murdered by the police. And as we were watching these videos, we were noticing that we were having reactions to them. And so we thought that if we were having reactions, a group of people with training to be able to respond effectively to these things, certainly the public might also be having some reactions. So we wrote this paper, #RacialTraumaIsReal. And we didn't put it in a journal, but we put it on a website because we wanted people to have access to it, because we thought that it was a good tool for people to be able to use in order to be able to help themselves, as they were also probably feeling some of what we were feeling. So as I was passing that paper out, students were commenting that some of it did feel really useful for them. At the same time, what I began to do is to go out on campus as a staff psychologist and talk to people about what some of our students, specifically our students of color, might be experiencing at that time. What I noticed while I was doing that is that I had not really created an environment for our faculty and staff to enter into the conversation. So what I did was retool the presentation just a little bit and added this concept of racial anxiety to it, which is how we end up with the presentation that you're going to see tonight. Now, I'll say to you that I can do a 3-hour presentation on this. I can do a 2-day presentation on this. And I train a lot of psychologists around the country in this area. So for me to condense this into an hour is really a feat. So let's see what all we get to here with this, with the conversation tonight. The other thing that I also want to do really quickly before I move forward with even the objectives and what I'm hoping that we'll do is to invite you to also recognize that as I share some about racial trauma and racial anxiety, you may actually begin to feel some things yourself, maybe in your body. And I want you to know that that's actually okay. I also want you to know that a part of understanding racial trauma and racial anxiety is to be in touch with your own body and to recognize that your body will have reactions or responses to this information. And why is that? Because you're human. A little bit of this is about the human experience more broadly, but I do want to focus on how it is that we respond based upon how we're socialized into this country as raced people, be that a person of color, a Black, a Latino, an Asian person, a Native person, or as a white person, okay? So really, I want you to be paying attention to how your body is responding to this information tonight. And as student athletes, of course, many of you, all of you, really use your bodies on a daily basis. So you don't have foreign relationships or sort of like these really distant relationships with your own body. You should really be able to tap into what it is you're feeling throughout this conversation. So I'm going to encourage you to do that as we move forward, okay? What I'm hoping that we'll be able to do is define racial trauma and help you identify what some of the symptoms look like, in addition to give some understanding about what racial anxiety is and how it affects us and our interactions with other people. And then hopefully we'll close out with talking about some considerations for how it is that you can respond to racial trauma or racial anxiety, both with yourself as well as in community, okay? So those are really my objectives. One of the things that I do with this presentation is, if you are not, can you just mute yourself? Can you make sure that you mute yourself if you are on the call? One of the things that I always do with this presentation is try to tell a little bit of a story about how race has been playing out in the past few years in this country as it pertains to the experiences of a range of people of color. As I tell this story, what I want you to see if you can tap into is what feelings and other reactions you have, what resonates with you, and what questions you still have on the other side of this conversation, right? Or on the other side of this news story that I'm going to tell, right? So really, but I want you to focus mostly on number one, what feelings and other reactions do you have as I move forward, okay? So go with me back to July of 2016. A gunman enters into a queer nightclub and says that he is there to kill brown people, Latino, Hispanic people. He is there specifically with the intention of murdering anybody who is Latino. He says that he's overlooking white and Black people, but he is there in order to be able to harm Latino people. I want you to think for a moment about what it could be like to be a Latino person entering into a space of privacy and a space of safety for yourself, which for many of these folks, that's exactly what a queer nightclub is, a place of sanctuary. So be thinking about the places that you consider sanctuary and what it could feel like to you if somebody had come in and disrupted that space and made it feel unsafe for you. We know that over the course of the past few years, the United States government has been going into Latino communities looking for people primarily because of the color of their skin, and claiming that they might be undocumented or people who don't have the documentation or the papers to be in this country. And I want to make sure that what you're hearing from me is not necessarily a political statement. What I want you to hear is about people, right? So the people in those communities are mostly all brown people, and nobody can tell whether or not they are documented or undocumented. But what we can tell is that they are brown folks. I want you to consider for a moment what it could be like to be a student who is a Latino student who calls home one day and doesn't get anybody there, or goes home one day and nobody is home. What it could be like to begin to think about where folks might be, knowing that ICE is out raiding communities and homes. Think for a moment what it could be like if you were being targeted and you get home or you call home and nobody's there, what that could feel like for you. Okay. We know that hate crimes are on the rise in this country for at least 5 straight years, actually. This is a headline that doesn't quite tell the story. Hate crimes have been going up, and the FBI statistics indicate that the folks who are most often targeted are people of color, queer people, and then folks who identify as Jewish. What I want you to think about, especially when it comes to college campuses, is what it could be like to be on a college campus where these numbers are also going up and people are being targeted for similar reasons. Think about what it could be like to be a Black, a brown, an Asian, a Native student on our campus, knowing that there are folks out targeting you or putting up paraphernalia or signs around campus that are saying derogatory things or hateful things about you and your body and the people that look like you. Consider what that could be like for just a moment. We know that back in early January, the World Health Organization declared coronavirus national or an international emergency. And what ensued immediately after that was there was a focus on who was responsible. Asian folks were placed squarely in the crosshairs of folks who were suggesting that Asian and Asian American people were the folks who were the instigators of the disease, the creators, the people who were spreading the disease. People were getting up and going to their jobs on a daily basis and being targeted because they were Asian. Notice here on this, on the left side of the screen, a reporter goes to do his job and he's attacked by folks who blame him for being somebody who is spreading the disease. Or consider being a doctor, a nurse, a chaplain, a social worker, or a psychologist who has been trained to work in a hospital setting to help people when they are at probably some of the worst moments of their lives. And you go in to help somebody and somebody tells you that they don't want you to help them because you're an Asian or Asian American person. They just make some assumptions about what you look like and tell you that they don't want you to help them. Consider what that must feel like to be rejected because of your skin color or some assumptions about your facial features. We also know that back in February, Ahmaud Arbery was running in Georgia, and he was eventually murdered by 3 men who chased him down. What we came to learn after the murder is that one of the men used a racial slur in the course of murdering him. Consider what it could be like to be a Black man running in a neighborhood, just out for a casual jog, not knowing whether or not you might be tracked down by some folks for no really apparent reason other than you are a Black person. We also know that you could just be sleeping in your home and be murdered. Breonna Taylor, a young woman who was a paramedic serving her city, was home asleep when the police got a no-knock warrant to enter her home. And in the course of trying to defend them, her partner shoots because nobody should be entering their home at this hour. And the police unload and Breonna is murdered. Consider what it could be like just to be going about your day-to-day life, maybe even sleeping in your home, and to have somebody come in and murder you, with this crime being one of the ways that they justify being able to come in. What we know is that Black men are not the only ones who are being targeted. We know that trans folk, lots of queer folks, are being also targeted with this type of violence. And I put this in here because I really want us to be thinking about the totality of folks who are being targeted at this moment in time. We know over and over and over again from so many videos that people are being targeted, whether or not they're armed, unarmed, sleeping, jogging, whatever it happens to be, or just coming out of a convenience store and having the police called on you and being wrestled to the ground and having a police officer put his knee on your neck for about 8 minutes. And people watch this video. Consider what it could be like just to be a Black person going to a random store and coming out and having to face the police, not knowing what could happen next. Here at the University of Maryland, we've had our own issues around race. Some of you were probably here back in 2017 when Lieutenant Richard Collins III was murdered on a Friday night as he was visiting our campus from Bowie State, about to graduate the next day or within the next week or so, but it was certainly graduation weekend here at the University of Maryland, and somebody who was known to have ties to white supremacist groups on social media stabbed him and killed him right here on our own campus. I remember coming back from a trip where I'd been out, ironically, talking to another campus about racial trauma. And I received a call actually from Cynthia Edmonds to come and be a part of a conversation about this race-related violence that had occurred in our classroom. And I remember coming to getting out of my car in the garage and walking down the sidewalk. And coming towards me on the sidewalk was a young white man. And I could feel the tension in my own body rise as he was walking toward me, I was walking toward him. I'd walked this pathway going to my office for about 3 years at that point. I'd never had that feeling before. I want you to consider what it could be like to be a Black person on this campus walking at that time or any time and not knowing what it is that could happen to you, especially given the racial climate that we all live in. There's also a way of thinking about how during the election season of 2016, there were lots of incidents on our own campus where people were spreading hateful messages. Regardless of whether or not you think that people belong here in this country, documented or not, what I want you to consider is to be a brown person and to be told that you don't belong here, that you need to go back to Mexico, when Mexico might not even be your home. Think about what it could be like on the receiving end of those messages. This next image is one that could be really sensitive for many of you. And I'm not here to be salacious, but I really want to be able to help you understand a pattern of violence and neglect on our campus. Jordan McNair, a young male student, a Black male student, who died in the course of being a football player here at this institution. And I put this here primarily not because of you being athletics, because I had this conversation a few months ago or a few weeks ago on campus. It's about a pattern of neglect, especially towards Black students' bodies. I was just in a conversation yesterday where a student was talking about how she and other Black women students have sought so many services and so many resources from the institution as it relates to how they feel targeted, how they feel unsupported. And what they continue to get is just be patient, just wait, we're trying. There has been a documented history of neglect, specifically around Black and queer people here on our campus. Back in 2018, there was a Campus Climate Study Commission, and that was one of the most significant findings that came out. Black people on this campus do not feel safe. Think about what it could be like here, coming to an institution of higher education, where so many of us come with our hopes and dreams of a future that our parents have promised us, or that our communities have promised us, that if we could just get into college, we would have a life-changing experience, but to get here and to feel unsafe, or to lose your life. Consider what that could be like. We also know that hate and bias incidents have been on the rise on our campus. Swastikas, white nationalist flyers, chalking, people yelling out of windows, people standing on Baltimore Avenue hearing the N-word thrown at them. There have been so many of these, and you'd be surprised to know actually that in the virtual setting, the numbers have gone up exponentially. people are actually being even more hateful in their language and how they treat people in the virtual environment. But what we know is that there's just a rise on our campus. And then we also live in a community that is still wrestling with its own relationship with racism. The city of College Park has now been having discussions about how it is that they reckon with the history of race and racism that has been here in this country, here in this city for a while. Okay. So I want you to take a few moments really quickly and just breathe in and check in with your own body. Get a sense of what it feels like to hear these stories. You might feel some tension in your body. You might be angry. You might have noticed that your temperature rose, or maybe that you were clenching your jaw, or your fist, or your feet, or your buttocks. You might actually have some sense of disgust, or you could be really sad. There could be a lot of different feelings that you could be having, and you could be having them all at the same time. But just check in with your body. If I were there with you face to face, or if we had more time, this is what I would actually ask you to do. I would ask you to share a little bit about what it is that you're feeling, and more often than not, I would ask our white colleagues to go first. And the reason why I do that is because more often than not in conversations about race and racism, when they're had in mixed race settings, people of color can share really easily. Well, I shouldn't say easily, can share because we've thought about this probably more so than some of our white colleagues have. And so the space can really be dominated by the thoughts and feelings of people of color. And what that sends is that there's a message that white people don't necessarily have a space in this conversation. But I want to really caution us tonight to really be aware that any dominant group, and here around race tonight, white people definitely have a place in this conversation. And so we have to disrupt the narrative that they can't speak about this, because they can't talk about race, they can't talk about racism, they can certainly talk about whiteness. So I will be encouraging you to be thinking about how to share as a white person what comes up for you. And then of course I would also have our people of color colleagues share as well, okay? But in the interest of time, we're gonna keep going. But I do want you to be thinking about moving out, as you move out of this space tonight, how it is that you might engage with somebody to actually have conversation about some of what it is that you're picking up, okay? So we can't really have a conversation about racial trauma without talking about racism. The definition that I've been using to really lay out racism comes from Dr. Kamara Jones, who is the past president of the American Public Health Association, and she's currently a fellow at Harvard studying really interventions for racism on a mass scale for the country. I heard Dr. Jones speak on a radio show about 3 or 4 years ago, and she was discussing the topic, should Milwaukee declare racism a public health crisis? Many cities in the Midwest right now are kind of wrestling with this question because they are noticing that they have some long-standing issues, especially around the disparate treatment of people of color communities where they are. I was really struck by Dr. Jones's definition because it kind of made racism a little bit simple for us all to be able to sort of like lean into and understand. She says racism is a system. It's not a personal moral failing. It's not even a psychiatric illness. It's a system of power, and it's a system of doing two things, of structuring opportunity and of assigning value. And it does those things based upon so-called race, based on the social interpretation of how we look. What I really like about this is Dr. Jones sets us up to really understand that racism really is a system. And what I want you to hear from me is that, that can be a really mystifying word to think about a system, but it's a thing that's much bigger than an individual, but we can't leave out the possibility or the fact that individuals also practice racism on a one-on-one basis. And without the system being in place, we don't get to do it on a one-on-one basis. So those things are really working together, right? And it's a system of power for her, and I really appreciate that, that there is a way that power structures opportunity in favor of some people while disfavoring other people, and also assigning value to some people, giving more value to some people, and taking away value from others. When you hear me talking about a pattern of neglect here at the University of Maryland, especially as reported by Black folks in particular, but people of color more generally, that's about value. People don't feel valued on the campus. If you don't feel safe, you're probably not going to feel pretty valued. In the same campus climate study, what we heard is that many of our white students feel like they belong here. They feel like they're included here. That's a sense of being valued, right? Opportunity structures are really about, if we want to use athletics, for example, I was just reading an article last night that talks about how, or a few days ago in the Washington Post, there was an article about how Black students' bodies are actually being used to fund disproportionately athletic departments, to the degree that it feels like white students are benefiting from the labor of Black folks, right? That's also about value, but what we see is that opportunity structures don't necessarily play out such that Black folks rise to the level of leadership in mass numbers in college athletics. Sure, we have a Black athletic director here, but if we look around the country, what we see is that Black and other people of color are oftentimes missing when it comes to leadership and coaching opportunities. So that's how opportunity structures actually favor generally white folks in athletics and disfavor people of color. So that's how a system of racism would actually function, okay? What I want us to really be able to understand too is that we have to talk about racism to move through to looking at how racism then trickles down and affects individual bodies. We've done a fairly okay job of helping people to understand how gender-related violence results in assaults on women's bodies most specifically, but men can also be the targets of gender-related violence. We've done a good job of trying to communicate that across college campuses. What we've done less of a job is helping people understand that racism also has very similar effects on people's bodies when it comes to how they experience being mistreated because of their race or because of their racial background, or how they're perceived as racialized people. What we know too from Ta-Nehisi Coates' writing is that he did it so brilliantly that racism is a visceral experience. It dislodges brains, blocks airways, rips muscles, extracts organs, cracks bones, and breaks teeth. When you think about the history of racism in our country, when you think about lynchings, when you think about people being beat, you can see that there is a way that racism is directly tied to those pieces. But what's also really important is that racism takes a toll on people's bodies. So even here in the 20th century or 21st century, where we see less of that, of course, we still see it in some of the violence that's directed towards Black people's bodies. But what we see is less of the violence, but more of the stress that actually affects people's brains, that affects the way our bodies function, right down to stress creating possibilities that we could lose our teeth. Stress contributes to dental problems for people, right? And I'm going to make the case here for you that what we're actually talking about is how stress begins to affect our bodies as a result of racism, okay? I want to play a video here for you really quickly that gives you a definition or an encapsulation of what racism and racial trauma look like. Dr. Monica Williams is a psychologist who is also writing about this. She gave this interview to a Canadian television station back in 2017, in the summer of 2017, after Lieutenant Richard Collins was killed here on our campus, there was a murder in Baton Rouge. A few days later, there was a murder in Minneapolis where police killed Black men. And then some police were murdered in Dallas. So within a 10-day period, we had police-related violence actually taking the lives of a few people. And Dr. Williams went on to this Canadian television station and gave the following interview. Pay attention to what stands out in her definition of racial trauma as you listen. Okay?
And when mass shootings occur, those who bear witness to such events are overcome with shock, horror, and grief, but often forget the need for self-care. Our next guest studies the effects this has on our mental health. Monica Williams is the Associate Professor of Psychological and Brain Sciences, and she joins us now. Monica, thanks for being here.
You're very welcome.
You write that we have cultural, historical, and community trauma, and all of these sort of contribute to a person's sense of traumatization. What do you mean by that?
Absolutely. So for African Americans in particular, we have trauma not just at an individual level, and that's how we've historically thought about trauma as a single event that causes a person to be traumatized. But now we're understanding more and more that the effects of trauma are cumulative. And for people like African Americans, we have not only individual experiences that cause us to be traumatized at times, but also historical trauma. For example, knowing that our ancestors were kidnapped from their native land and then forced into slavery, followed by cultural traumas such as government abuses and community traumas such as these shootings.
And so how does that collective trauma affect the individual?
It can result in symptoms of post-traumatic stress syndrome. And it's a very unique kind of trauma because, again, it's not just from one event, but it's from a culmination of events. And it could be triggered by a big event, but it could be triggered even by small acts of racism.
So how do people who witness or are affected by such events that we're seeing right now feel threatened?
Well, we see, for example, unarmed Black men being shot and killed by police, by people who are supposed to protect and serve the community. And we get the sense that the police are not there for us. They're there to protect white individuals. But if we had a need, they might come and they might not help us. In fact, they might kill us. And that makes us feel like nowhere is safe for us.
And how important, of course, is that safety?
It's very important because if you don't feel safe in your environment, you may be anxious, you may become paranoid, you may begin to feel helpless and depressed. It's connected with a whole host of mental health symptoms.
Now, what about the shooter himself? He came back and...
So I don't talk about the shooter in this presentation, but what I really want to be able to hammer home for you is this effect. What I'd like to be able to do is something that I always do in this presentation, is ask you to take to the chat box and just put in any thoughts that came up for you around what stood out to you in her definition of racial trauma. She said quite a few things there, and I probably should have told you that I wanted to do that in the chat box, but take to the chat box and just put in anything that stands out to you and what she shared. I'll read out a few things as they're coming into the chat box. She talked about the cumulative nature. She talked about the collectivistic features of it. She talked about historical trauma. She talked about how people's bodies respond to this. Just take to the chat box and just jot in a few words about what it is that comes up for you or what stands out for you and how it is that she defined racial trauma. I know y'all can put stuff in there. I see the happy birthdays, Teresa. Historical trauma stood out, yeah. There's a way that, and this is a really important piece of racial trauma, especially for people of color in this country, and generational trauma is about being connected across the years to other people of color, whether or not they are people in your household or in your family line. I should have probably included this video. Many of you probably saw Jacob Blake's sister, the man who was shot 7 times in the back. When she gave her first comment, she talked about many of you have called to apologize, and I remember apologize for this happening to my family. And she said, well, this has been happening to my family. Emmett Till was my family. Sandra Blake was my family. And she was really thinking about being connected in time or across history to folks who had also experienced race-related violence and had lost their lives, right? So there's this way that people of color feel connected across the ages. No matter how drastic the racial reaction was, it still leaves a mental mark on you, definitely. And that's the piece that I want us to really pick up today before you leave, because I want you to be able to understand that your body's functioning can be compromised as a result of experienced race-related trauma, right? PTSD symptoms is certainly something that I would talk about way more if we were in a clinical setting, but what I'm gonna share with you will give you an idea about what PTSD could really manifest as, okay? And then I see somebody put, it could be small or large racial events, exactly. So if you're thinking about sort of like the murders that are happening or us being exposed to the murders via the news, that's one thing. It's another thing to be sitting in a class and to hear a colleague or a professor or to be on a field and to hear somebody use a racial slur that may not even be meant for you or for your body, but to have that hit your body can really send a person into a really traumatic state. So there's this connection across time and across space and across incidents that becomes really important for us to be able to hold on to, okay? Somebody put how the trauma stress can actually trigger harmful physical reactions in the body. Makes me wonder, is that related to people of color being more susceptible to some diseases and illnesses? You are on track because what we know is, and I don't have this video on here tonight, but so I'll just make this point. What we're actually talking about is a stress reaction in your body. Many of you know that when your body's under high stress, it releases more cortisol. When the cortisol gets released in your body as a result of a race-related incident, well, here's what the research tells us. White people and Black people can experience the same event at the same time that feels race-related. White people can go home and go to bed, and their cortisol levels will come down once they get to rest. For people of color, our cortisol levels do not go back to normal because our bodies are still flooded with that reaction. Increased stress levels in the body over the course of time, what that means is your body actually, the immune system in your body becomes weaker. Therefore, we're more susceptible to things like heart disease, lung disease, kidney disease. So yes, our bodies are much more susceptible to disease and illness as a result of racism, which is really a correlate for stress, okay? Okay, so I'm gonna keep moving here, but I appreciate people going to the chat and putting in your comments. What I wanna lay out here for you next is really just some considerations for how it is that we define racial trauma. And this definition is one that I've kind of pieced together from a number of different scholars. But we're really talking about the body's, the emotional and psychological response to racial incidents that are often unexpected, experiences threatening, and result in significant psychological distress. Unexpected because if you think about it this way, go back to coming to the college campus. Many of us come with the hopes and dreams that this is gonna be some of the best times of our lives. We get here and then something happens that kind of destroys that around race or around racism. That's the unexpected nature of it. You're just kind of going about your day and here's something just jumps out, right? It can be experienced as threatening, primarily because the body doesn't feel safe anymore when you are targeted because of your race, when racism is thrown at you, right? And then when you don't feel safe, your body certainly degenerates into a place of possibly feeling really distressed, okay? Here are some other ways of being able to think about and racism. That it is a severe stressor and it can happen both at the personal level as well as the larger institutional level. I would argue for you that the way that the institution responded to the murder of Lieutenant Richard Collins III, not being able to tell the truth about that being a race-related murder was really distressing for a lot of people of color on this campus. If we're not telling the truth, it actually compounds the stress. It's often motivated by hate or fear of a person because of their race, so it's because of the perception of your race. I want to be really clear about this too. It's not because I'm a black person somebody's attacking me. Somebody is attacking me because they perceive something about my race that it is that they don't like or that they hate or that they fear. It's a perception of me that actually motivates a person. It's a real emotional injury. Go back to what I was saying from Ta-Nehisi Coates, who really talked about the body. But this is also a really severe emotional injury, and we'll get into more of that as I move forward. More often than not, when we're talking about somebody who is racially traumatized, we're talking about somebody who either in the moment or for a prolonged period of time may not actually be able to cope and move out of their stress response or the trauma response because the body begins to shut down when it is that we feel traumatized, or the body could actually become hyperactive as a result of being traumatized, and I'll talk more about that in a second as well. There can also be this fear that there's going to be some threat to your life or the life of somebody that you are connected to. And then most importantly, there can be a real sense of helplessness or horror that goes along with this. Really a sense of powerlessness. I don't know what to do, and I'll talk more about that in a second as well. Here's some other ways of thinking about this. The top one is really there's a piece of the top one that you're targeted because of your racial group and the status of that racial group within society. We all go to school and we all understand how the racial hierarchy has been set up in this country. We would be dishonest if we didn't talk about that being an actuality here. And so to be a person who is darker skinned and to be targeted because you're at the lower end of the racial hierarchy is one of the ways that you can, that can be stressful for you. And then it's a cumulative experience. Again, it's not just that this one thing happened, but it's this one thing that happened connected to the thing that happened 2 days ago and the thing that happened a week ago in the classroom, and then that thing that happened when I was a senior in high school. So it becomes about a cumulative experience for people that we have to keep in mind, okay? Here are just some real examples of the way that could look, right? You could be treated hostilely in your work or classroom environment. Somebody could use verbal assaults, whether or not that is racial tropes that are being thrown at you, or you could be denied access or denied service somewhere, or you could be just being racially profiled, which still continues to happen, interestingly, in 2020, okay? So those are some examples of it. What I want to do next is really give you an idea about how this begins to affect people's bodies. And this is the really important thing, especially for many of you as students, right? What we know is that, and I want to do this in talking about the emotional, the physiological, the psychological, and the behavioral, right? I'll start here with the emotional. What we know is that people experience a range of emotions, anger being one of the ones that is probably most common. I would suggest to you that anger is also the one that many people fear, especially in the context of this country. People don't like race-related anger. But what I would say to you is that anger, race-related anger, is actually one of the ways that a person of color begins the process of healing or helping themselves. Anger is a reasonable reaction to being treated poorly, to being discriminated against, to being left out, to being having your life taken away or having the life of loved ones taken away. It's a really reasonable reaction. When we try and tell a person not to be angry, what we're actually telling them is that they should not be having a very normal human reaction to something. When we do that, we are gaslighting them. We are telling them that they should not, that their reaction is unjustified. And that becomes really confusing for people. If you encounter somebody who is angry because of something that is race-related, what you actually want to do is encourage that anger. Anger has gotten a bad rap in this country. It's not going to burn us down. It's not going to destroy anything. What we actually know is that there has been no social movement in the history of this country at which anger has not been at the heart of. Whether or not it's the American Revolution, the women's rights movement or the women's right to vote movement, the civil rights movement, the queer movement, Black Lives Matter, there is no social movement at the history of this country at which anger has not been at the heart of. And each one of those movements has actually pushed the country a little bit further to being closer to its ideals, okay? So anger has gotten a bad rap. People are angry, they're not gonna kill you, they just need to get something out of their bodies, a very reasonable reaction out of their bodies. The last one there that you see is shame. And I'll talk more about that in just a second. I think there's a slide where I talk about that. The physiological. What we know, because of the stress hormone in our bodies, cortisol, when our bodies get flooded, we actually have pains and aches, or our body systems don't function as well as they could. What we know is that specifically for a lot of people of color, they might be able to report that they're having a stomach ache, or that they're having a series of headaches, or that they could be even having some muscle spasms. More so than we might be able to talk about some of the emotional stuff. But this becomes a gateway into understanding what could be happening. Am I saying that racism is the only reason why you would be having pain? Of course not. I'm talking to a group of athletes, so you know that that's not possible. What I am suggesting to you, though, is that if your body is stuck with high cortisol levels for extended periods of time, this is what could happen to you, okay? Behaviorally, what we see is that people either cease some behaviors that are really common to them, or they begin to do behaviors, they begin to cease them, or they begin to overdo behaviorally. A person can become really aggressive, they can sleep more or sleep less. A person can really become engaged in using substances in order to be able to soothe themselves, or a person could to figure out ways of being able to sexually stimulate themselves in order to be able to feel some type of release or relief from the stress that they're experiencing. All of those really are about how am I soothing my body in order to try to get back to some homeostasis for where I know my body was supposed to be. But more often than not, it doesn't work. It's just a temporary fix. But it's always about trying to soothe the self. And then here, this is probably one of the most important ones for you as a group of student athletes, is that cognitively people can be off. People can have intrusive thoughts. A race-related incident happens, somebody calls you the N-word, and then that just keeps popping back into your head without you even thinking about it, but it just comes back. What we know is that if that happens, it's more than likely that people will begin to just ruminate or turn that thought over again in their head relentlessly and continuously. That's what a rumination is. And what that leads to is the inability to focus. If you've got intrusive thoughts and you're nursing this thought all the time, you're not going to be able to sit down and focus and concentrate and get your work done. We also know that it leads to poor memory. It's much more difficult when your brain is not functioning the way that it's supposed to be, that you're going to retain information, or that you're not sleeping the way that you're supposed to be, that your brain is not going to retain information. And then it can actually lead to a poor self-concept. And in the context of higher education, I always talk about the possibility of it leading to a poor academic self-concept, or even in your instance, it could lead to a poor concept of yourself as a student athlete. I think back earlier this year, actually, at Penn State, there was a story about a student athlete, I think it was Penn State, a basketball player, who was in a conversation with his coach, who made some comment about that was a reference to hanging. And the student athlete, who was doing well up until that point, his performance sank after that incident with his coach, and he was actually stuck there for a little while. That is a really good example about how racism or racial trauma can affect one's performance. in the context of being a student athlete. Okay? So there are the symptoms, all of them. What I want you to be thinking about as we move towards the final section of the presentation is really understanding that your body could respond in a number of different ways to racism and race-related trauma and stressors. You may not experience all of these. You may not experience many of these. But what it could be is the case that your body is now responding in a way that is really not typical for your body. Even if you if you just lose your memory, right? You lose your capacity for being able to remember schoolwork or to remember plays that are being called by the coach. There are ways that if you're not functioning at the way that you know your body normally functions, that could be a sign of a stress reaction that your body is having, and you want to get you want to be able to talk through that, okay? Or get some assistance for that. One of the ways that this plays out for white people is generally what we call racial anxiety. I noticed this on our campus in the aftermath of the murder of Lieutenant Richard Collins III. And what becomes really important for you to understand is that racial anxiety is common for many of us. And it's really, again, these heightened levels of stress and emotion that occur for us when race actually becomes a part of a conversation or becomes a stimulus in the room where we find ourselves. People of color experience racial anxiety, and more often than not, that anxiety is that I don't want to be targeted, I don't want to be dragged into this conversation about race because this is not something that I want to do, or I feel like people are going to be hostile towards me. What white people fear the most in race-related situations and conversations is that they're going to screw something up and people are going to assume that they are racist. What we know is that that can be a really paralyzing feeling in this country. I think studies have been done that say one of the things that people fear the absolute most in this country is to be called a racist. It's right up there with snakes. Being called a racist and fear of snakes are really run close with regards to the biggest fears in this country, okay? This is what racial anxiety can look like. People might smile less or they smile more interpersonally, right? And what that could also look like is a person could back away from a relationship or look away from a relationship, somebody that normally they have been really highly engaged with. A person could become really overly friendly as a way of being able to compensate for their own anxiety. Or what happened on our campus back in 2017 is that people really moved away from relationships. When I talk to when I talk to staff people the summer of 2017 after the murder of Lieutenant Collins, many of our Black and Latino staff members talked about having good relationships with their white coworkers. And their coworkers would come to the office, and what they would do is that they would go to their individual offices or their cubicles and they would close the door. They wouldn't engage in the immediate aftermath of the murder of Lieutenant Collins III. That's what racial anxiety looks like. People don't want to make a misstep. They don't want to step in it. They don't want to be called racist. They really fear that the most. Here's some other ways that racial anxiety could show up. And I won't go through all of these, but I will put out there, because I didn't talk about this earlier, so I'll talk about it here. Shame is one of the things that can happen for a lot of white folks. And shame is different for people of color in this situation and for white people, but I want to talk about it here as it pertains to white people. White people can begin to feel the sense of dread or that they are not really good people because of the way that racism is playing out. And I would suggest to you that it's not necessary to not feel like a bad person, to feel like a not good person. What becomes really important is that we move out of the shame, because what we know that shame does is that it keeps us from having relationships with other people. Shame always says to you that you are a bad person, and bad people don't have good, healthy relationships with other people. So that's one of the ways that it can manifest. The other way that it manifests is in politeness. And this is one of the ones that I've seen across our campus almost relentlessly in the course of the 7 or 8 years that I've been here. I like to actually call it the culture of nice. There's generally a story that I tell with the culture of nice, but I won't go into it because, actually I have a little bit of time. When I was a graduate student at Boston College, is where I got my graduate training, I entered into a master's level cohort of mental health counseling students, and there were 60 of us. Entering into that cohort were about 50 white women, and then the remaining 10 of us were a combination of white men and then people of color, including men and women. And there were maybe 1 or 2 international students in that program. When you're training to be a mental health counselor, one of the ways that you develop your skills is that you practice in what we call labs. You go to a lab with about 10 other people, following a lecture where you learn about a skill and you take from that lecture the skill that you're supposed to go and practice in the lab. So we would leave the classroom, go to our lab with these 10 other people. And more often than not, I think in my lab, there were probably about 6 or 7 white women and then the rest of us. And here's what would happen when we practice. We would practice in what you would call a fishbowl. There would be 2 people in the center, and the rest of us would be in a circle sitting outside of them, observing what they were doing so that we could give them feedback about how it is that they were practicing. Here's what would happen after a group of people would practice. Some of the white women in the room would say things like, "You're amazing at that. You're going to be a great counselor. I can't believe how good at you are at that in just such a short time. I wish I could do that as well as you did." I would be sitting there in the class looking at them and thinking, what are you talking about? The person didn't even practice the skill that Dr. Sparks, the professor, told us to practice. So I was really confused about that, probably for like the first 4 or 5 weeks of my program. I remember having a conversation with my advisor about this, and she said to me, "Oh, you don't know? We have a culture of nice in mental health counseling. We don't give each other hard feedback," which was mind-blowing for me, considering that we were all trained to be therapists, and a part of a therapist's role is to give people difficult feedback. I would argue to you that this is not just a symptom of, or not just a characteristic of mental health counseling training. It's actually a characteristic of higher education. And it could actually be a characteristic of some sports, not all, but it can show up in some sports. Really what it is that there can be this focus on complementing strengths of what's really good about a person. We do everything that we possibly can to avoid disharmony. We want to make sure that there is harmony. We maintain really surface level conversations. We won't go deeper. And if there's a way that something does begin to shift in our relationships where it feels like some negativity is coming in, we figure out a way to blame other people. Now, in the culture of sports, I know that you probably don't get all compliments and strengths on what you're doing. Compliments on what you're doing. There are ways that people give you really hard feedback, and you can have some really intense conversations. What I really want to point out here is that this is about when race becomes a part of the conversation, right? When race is a factor in a conversation, people can resort to this culture of nice, and it actually disrupts our ability to have authentic conversation. What I know is race-related conversations are very difficult and challenging. The culture of nice says we got to stay nice and we got to stay positive. Those things don't generally go together, okay? The other thing that gets in the way is people's beliefs about emotions, which I've already talked about. The anger piece, I don't need to spend too much time on that, but really emphasize here that anger becomes really important because it's loaded with information and energy, and we have to actually nurture people's anger in order to be able to move through whatever it is that they're feeling. The last one, though, that I want to point out for you is what we call this racial empathy gap. What we know is that well, I'll talk about this really from a research perspective. Doctors, when they are asked about how it is that their patients experience pain, what has been proven is that doctors do not believe that Black people experience pain the same way that white folks do. In fact, doctors oftentimes think that the pain receptors in Black people's skin is not the same, or they might think that our bones are stronger. We can just tolerate more pain, okay? And so that has not only been proven for doctors in adult populations, but also for children's populations. Children showing up to emergency rooms with really serious problems, when they are children of color, they are perceived to be in less pain than they are when they are white children. So they get treated differently. And then one of the things that is most perplexing to me is that, and this kind of gets a little bit closer to higher education, is that social workers have also often reported that they perceive that people of color experience pain very differently, or less, to a lesser degree, than white people do. The reason why I put this, and the reason why that's important is because social workers opt into their field in order to be able to help people. More often than not, helping people who are under-resourced or underprivileged, working in communities of color, working in poor communities, in order to be able to bring services that those communities need, right? So they are focused on helping the very populations who they perceive as not necessarily being able to experience pain the way that white folks do. The reason why I include that in this conversation is because I think that Kirk Herbstreit actually demonstrated this past weekend on College Game Day, if you watch that. Kirk was overwhelmed with tears as he was talking about listening to a story I think that the Stanford head football coach was talking to him about really acknowledging that there have been stories about race and racism in locker rooms and among sports teams for a while, but there's not been a lot of listening on the part of, more often than not, white players who hear these stories. And Kirk was really overwhelmed in saying that we've got to do better. We've got to start listening. That's how the racial empathy gap really plays itself out. We're not paying attention to the distress that more often than not, our people of color students or our student athletes of color might be experiencing, because we have these real stereotypes about how strong they're supposed to be. There's also research that's published here by one of our own faculty members, Dr. Rayshawn Ray, that was tuning into college basketball games and listening to how, and this has happened in football as well, listening to how sports commentators talk about Black and white student athletes. White athletes are referred to as being smarter, more intelligent, whereas Black athletes are often referred to in much more beastly terms. And so again, they're dehumanizing those bodies, saying that they don't necessarily experience the world the way that these smart white athletes do. That's another way that perpetuates this racial empathy gap, not seeing people of color as human, okay? That also contributes to, or as a real barrier for how it is that we address the racial trauma that people of color experience. What can we do about this? This is the last slide here that I want you to walk away with. When we're talking about racial trauma and racial anxiety, there has to be some acknowledgement that this is what's happening for your body. This is, again, why I wanted you to check in with your bodies throughout this conversation. For people of color, it means actually getting into a place where we can say, I'm actually not okay. I might actually be experiencing some distress as a result of this racism. It's moving away from the narrative that many of us have been taught, that racism is out there, we just have to keep going. That's actually quite inhumane for our own bodies. So there has to be some acknowledgement that racism is affecting our bodies. Go back to how racism generates stress, the cortisol hormone in our bodies. And that can be really harmful over the course of time. For white folks, there has to also be an acknowledgement that I might be feeling anxious about this conversation, or I might be feeling anxious about the possibility that race could be a stimulus here. When that happens, one of the things that I oftentimes say to my clients when I'm working with them in therapy or in professional settings when I'm training people is that, especially in that instance, you get to say, I'm feeling anxious about this conversation right now. The moment you say that, what it actually does is it takes away some of the power from the anxiety that you're experiencing. What many of us know is that when something makes us anxious, we want to create distance between us and the thing that we think is making us anxious. So we just want to get away from it. In these situations, actually speaking to or speaking about the anxiety lowers the anxiety level a little bit so that you can stay in the conversation, okay? And you can just do that even with yourself. Discussing, being with other people, well, actually that's not true. Discussing could look like actually just getting it out of your body. If you journaled about it, if you did so like a YouTube or Facebook, or no, that's not the right thing, IG post for your generation, or if you tweeted about it, getting it out of your body is actually what's most important, right? And that goes for both the trauma and the anxiety. You've got to figure out how to externalize that. If you don't give voice to it, if you don't give it a way of coming out of your body, it actually sits in your body, and that's when your stress levels begin to go up, okay? Then seeking support becomes important. And this is a really important piece to this. And I say that because, here's the caveat that I add. When you seek support from somebody, you want to seek support from somebody who has as much, if not more, racial consciousness than you do. That becomes important because as a person of color who's been traumatized, you don't want to sit with somebody who tells you that you're making this up in your head, or that somebody didn't actually mean to be racist to you. That actually only compounds the person's trauma. You want to be with somebody who's going to validate and affirm for you what it is that story is that's living inside of your body so they can get out of your body. That's a really important part of the healing. For white folks, being with people who are more racially conscious than you is also about being with somebody who's going to challenge you to talk about how it is that you may have been afraid or anxious or maybe even racist in a situation so that you can grow from it. You don't want to be with people who are just going to affirm for you, they were just being too sensitive. You're not really that type of person. we can all be racist, or white folks can all be racist in some ways. People of color can evidence internalized racism or anti-Blackness that can really disrupt situations, but it's part of all of our experiences. And so to be told that you're not that type of person is actually not doing you a service. It's actually not helping you to grow your muscles around being able to stay in race-related conversations. Then the self and community care piece is also about seeking support, but it's about, what are you doing? Are you talking to trusted loved ones? Are you talking to a religious leader who can help you, or a trusted mentor? Are you actually moving out to have relationships with people who are going to affirm you? And that goes for both people of color as well as white folks. The last piece is about empowerment through resistance. Are you actually doing things that help you to channel this anger that you may be feeling, or this anxiety, this worry, this frustration that you may be feeling? That can really be about a number of things. You could post on social media about what's going on, with reason, of course. You could join a political campaign or go to a march. Even if you are a person who's introverted, you can begin to pick up the phone and call your local state house or your local government or the state house to advocate for racial justice issues. There are lots of ways that you move into resistance around that anger or that frustration that you feel, in order to be able to liberate yourself and feel like you are part of something bigger and not just feeling disconnected from other people who are like you. For white folks, there's a piece of this that's about joining groups that are focused on enhancing white racial literacy, understanding of race and racism and how it functions in the world. That actually too can be very empowering for people who are looking to move beyond being stuck or just being immobilized by race and racism. Right? So there are ways also that white folks can move into community. If you have time, I would encourage you to be reading some things. My Grandmother's Hands is a great book that's becoming more and more popular these days about racialized trauma. It's probably the #1 thing that I'm recommending to people right now. I'm actually listening to it myself. It's a really important book that this man talks about the trauma of white folks' bodies, the trauma of people of color bodies, as well as the trauma of police bodies. So it can be really useful, with a lot of really helpful exercises for being able to get into understanding your own trauma. And then the last book there is a book called A Race is a Nice Thing to Have, which really focuses on helping white folks to understand white racial identity development, what it means to be white in this world. You'll notice that the title is A Race is a Nice Thing to Have, A Guide to Being a White Person, or Understanding the White Persons in Your Life. It's actually written by my advisor, Janet Helms, who is a racial identity scholar, brilliant mind. It's actually a workbook that you could use as well, okay? So that is really the presentation. Here are some of the offices that you could reach out to if you are having trouble understanding or negotiating race-related issues or racial trauma-related issues. Certainly in the Office of Diversity and Inclusion, we can help out. But Bias Incident Support Services is another one where you can report issues of racism and get some trauma-focused support, or the Office of Civil Rights and Sexual Misconduct will also take those types of reports, okay? I think that is my time, right, Risa? Yep, 8:07.
Dr. Green, I just want to thank you for coming on and giving us this presentation today. Again, there was a lot of information kind of given to our students and staff today, and we will continue to have ongoing conversation, as Damon mentioned earlier today, now with Cynthia coming on board. So you now have a few more folks to reach out to from a campus and a department perspective to continue having this conversation. So with that being said, thank you everyone for your time tonight, and thank you, Dr. Green.
Sure, thank you so much for having me. I really appreciate it.